The PPC patients, physicians, and other healthcare providers together as active members in a healthcare cooperative. That's our commitment. The objective is fair prices for medical services and procedure. And I mean, the patient is paying and the physician is getting a fair price for it, and the patient is paying. It's both sides of it. It's not free for the patient and punishing for the physician. In our programs, we always have baseline prices for everybody and commitments from the insurance carriers that we do business with to pay performance bonuses. In other words, to give us part of the profits that they have in their premiums. And that's worked out very well for us. We have cost transparency. We give the patients a list of all the prices that we've contracted for. So patient has the prices in their hands, the doctors have the prices in their hands. No kidding. The 10,000, the list that you have in your book of the 10,000 service codes and the prices for each of them. All right. We include the membership in all the plans that we offer. In other words, the membership for primary care and for preventive care is included with the insurance programs. All right, what do? We have access, advocacy, payment plans, and association insurance. Somebody could come to us, join the co-op, and say, look, I don't need insurance, I don't need a prepaid program with the provider, I'll just pay cash when I come to the office. So what do you have? You have a way to see the physician knows that that patient is going to pay cash at the time, and they know how much they're going to pay, and they can collect it. So that's the minimal participation with us. You can be a member of the co-op and just pay cash wherever you go, but you know what the prices are going to be. So it's an acceptable arrangement. Then advocacy, some people leak out of the system. Some people don't go to the co-op physicians. Some people wind up in the emergency room someplace, and then they get a bill that's just unbelievable. They can't believe it. It's thousands and thousands of dollars for something that turned out not to be very serious. So they come back to us and they say, would you go talk to the hospital about this for me? And so that's our advocacy. We go back and say, they're a member of our association. We have lots of people that come over and use the hospital. I wonder if we could take a look at what your programs over here are for this patient settling up their debt with you, and can we do something about it? And that's an important part of what we do in the co-op. All right. Now, the rest of it, primary membership benefit, advocacy, as I just mentioned, and then primary health care services, like 4 parts. You can make a deal between yourself and your primary care physician to pay them monthly in advance for their services. Diagnostic imaging. We have 2 diagnostic imaging centers that have agreed to a prepayment program for the patients, so that for $20 a month about, people can get MRIs, CTs, and ultrasound and X-ray and PET scans at 2 locations right now. And we can add more to that as we need to, but that seems to, we've got a year's experience with that with the patients, and so far the imaging centers are not complaining. So I don't know whether that means they're being underpaid and they're not paying attention to it, or they're being overpaid and they're very happy with it. But so far the patients like it, and the imaging centers have not reacted to it negatively. So I'm pleased with that part of it. But everybody's gotten the scans that they needed. All right. We have lab services, which were mentioned earlier, from CPL, and that's very inexpensive. It costs a patient $3 a month to participate in the lab services program. And then we have group health insurance, and that's the $25,000 policy that I mentioned earlier that's designed to fit the co-op program, and it's designed around our physicians. And if the people don't join the co-op and take a primary care physician and do a prepayment program with the primary care physician, they can't get the insurance. And if they and they don't pay the primary care physician, they lose their insurance. So there's incentive. They can't just come in, do business with the primary care physician, buy the group insurance, and walk away. They have to stay in the co-op, and they have to stay with the primary care physician and with the specialists that are in the co-op in order to keep their group insurance. All right, and it's first of all, it's a limited policy for hospital benefits, $1,000 a day for 15 days, and ICU is $1,500. And some of the member hospitals, in this case it's Oak Bend, have agreed to an $1,800 a day charge, which means the patient will be out $300 a day. Surgical admissions are $3,000 for the first day and $2,000 for the second day and $1,800 thereafter. But that kind of co-payment that they would have to make with their benefit is less than the deductibles and the co-insurance on these major insurance policies. So they're still out less money, as I've shown in the example preceding this. All right. If you want to increase the limits to $1 million, well, then you get $2,000 the first day and $1,500 a day for 364 days. And if we have a group of people that have 50 or more employees, then they waive any underwriting on this larger policy. There's no underwriting on the small policy at all anyway, but there, on the large policy, the $1 million policy, there is underwriting, but if you have 50 or more employees, they waive that, and all pre-existing conditions are waived. All right, here's an example of the cost of the plan where you have primary care physician, diagnostic, lab services, dental, vision, specialty fee services, fee for service, and hospital services at fee for service. You can buy this for somebody age 0 to 17 for $68 a month, $76 a month for 18 to 44, $86 a month, 45 to 64, and $106 a month for people over 65. Now remember, this is not with insurance. This is just primary care, diagnostic imaging, comprehensive lab, dental, vision, fee-for-service for specialty physicians, and fee-for-service for the hospital. All right. And then if you add insurance to it, it's not appreciably more. As you can see, the $25,000 policy is $126, $178, $282, and $691. And the $1 million policy is $146, $253, $357, and $764. So those rates, if you check those rates against the market and what's being charged in those age groups, you'll see that they're going to be anywhere from 25 to 50% below market. Even though it might seem high to people that don't have insurance and haven't been buying insurance, they're quite low in the market, and we expect a good market penetration with this particular product. And that ends that side of it.